Hello, everyone. We'll join in a couple of minutes. We'll let people jump in. Thank you for all who have joined so far. Let's give it a minute to see if there's anyone else who's joining. There's a couple still coming in. Cool. Let's begin. There'll be a bit of an introduction. So before we get started, thank you all for joining today on our accuRx web webinar. Before we start, we will be recording the webinar as usual. We'll share in our Facebook accuRx web community group, as well as post on our YouTube channel where you can go and see, share with colleagues or anyone who might be interested, or have a look back if there's anything. We'll be demoing some of the software as well, so that will be useful. There's a Q&A function at the bottom of Zoom. Feel free to ask any questions. We'll have a specific section time at the end where we'll answer all the questions live, but feel free to send any throughout. Please do upvote any that sound interesting or anything that you would ask as well. That will help us prioritize the questions towards the end. On what we're going to go through today, we'll start off with Matt, product lead, which will be giving a vision of accuRx Web. I'll be taking through a live demo what's currently available in accuRx Web, and then we're going to have a look at what's next in the roadmap, as well as a couple of features, record access and accumail, which we're currently testing and piloting, and we'll have Satya demo through. And yeah, we'll answer questions at the end of the webinar. We'll answer them live, and as I said, if you have any, feel free to add them before, and please upvote. So I'll hand over to Matt.
Sorry, I couldn't find the unmute button for a second there, rather embarrassingly. Hi, everyone. Thanks for joining today. I thought it'd be useful for us to recap, I suppose, both our vision for accuRx, but also accuRx Web in particular. So some of you may have seen this at future or at previous webinars, but just going to run through quickly to give a bit of context about where we see web going and kind of like the things that you're going to see in demos today, and hopefully add some context around them. So we believe, as accuRx, as a company, that healthcare is a communication industry. It's moved on from being that knowledge industry. And for that to be really successful, everyone needs to be able to communicate with each other about a patient when they're looking after them, and that also includes communicating with the patient. We've done quite a lot of work with this in primary care, and we're starting to do this in secondary care. But like this is the vision, and this is the mission that accuRx has. So we've started the web product a little while ago now, but as you know, we have actually got to this point because we've grown to being ubiquitous in primary care. So prior to COVID, we were in around 50% of GP practices. We're now in 99% of GP practices across the country. That's England and Wales. And we want to do more to have the same impact across the whole of health and care, not just in primary care. So we're really interested to see how we can deliver those advantages and benefits in other settings, but also join up communication across them. Video consult was the beginning, or sort of like the main driver for the web product for us. There's probably quite a few of you on the call who use us for video consultations. Hopefully some of you are using some of the other features. We'll demo those as well as you go through this session. But we're definitely looking at how we can grow on from that. And our learnings in general practice have been that asynchronous messaging is really so powerful. It enables people to do things at the time that they need to do them, when they want to do them, and that works for people, you know, in both settings or in whatever settings they are. We know how hard it is to get everyone on a call at the same time, or everyone to be in the same place at the same meeting at the same time. So these are the things that we're starting to think about and bring forwards for web. Now, one of the things that we have a vision for is that, you know, in 30 seconds from web, you'll be able to message a patient, you'll be able to message their GP, or, and we're going to demo this today, you could view their GP record. And the reason for this is that we started looking about communication and our vision of being able to like be involved in a patient's care and talk about the patient. And when we spoke to clinicians, a lot of that communication was around the information that was in their medical record and what was important to them. So we support you sending messages to patients already. And there's a few of you being able to send messages to patients' GPs as well, something that we'll demo later. But we know that a big gap or a big area where we can help is that knowing information about the record or things that are locked away. So, you know, questions like this: what meds are the patients on? What chronic conditions do they have? All of those things that get asked really frequently. And the reason that we're like taking on record access and going to again demo this later is that we know that places do have good agreements. We know that there are things that set up, but we know that it's also patchy in places, and you know, out of area patients can often provide a new challenge if they're not in a GP practice where the trust has a data sharing agreement. Perhaps you don't have the right permissions, or what you have doesn't have the full record. So these are some of the challenges that we see coming down the line about being able to communicate about a patient to help them have a great experience. You know, you will need this information. So like, what's next? Today, we're going to take you through some of the features that we already have in the product, hopefully to help you get the most out of the product that you're already using. We're also going to tell you what's coming up next and a couple of our big things that we're working on now. And hopefully this vision will sort of kind of just set the area for that, so you'll see how we're working towards it. We'll be very happy, as Eleanor said, to take questions throughout and pop them in the Q&A as you're going. So to start with, we'll give you a demo of some of the key features now and how to get the most out of web. And I'll pass over to Eleanor.
Perfect. Thank you, Matt. Share my screen. Excellent. So you can now see my screen. We've got, so this is the site of accuRx Web. You'll previously obviously log in either with your nhs.net email through the single sign-on, or if you've created an account already. And so you come onto the home page, and that's where you can start communicating with patients. So the usual flow would be to search for a patient individually. So you will either type in the you will type in the NHS number and date of birth, and then click to search for the patient. You can give it a try as well by using the test patient details. So this will automatically populate it with it. You click on search for patient, and that's where it then takes you to the next steps, where you can, one, confirm it's the right patient you want to contact, and then either send a video consult invite, message the patient, or there is also an option of accumail, which my colleague Satya will go into a bit later. You can go back, or you could have clicked change to change the patient. But there's another feature that we've introduced a couple of months ago to make it easier, so you don't have to search for the patient every single time, or so that you can save those searches in one place directly. So you might have seen this at the top. It's called patient lists. I've set this up already. In case you haven't, you'll have an option over here to set it up with your mobile number. What that will do is that you'll set up with your mobile number, you'll receive, when you need to access your patient list, you'll receive a text message with a 6-digit code. You'll have no medical information on it. It will just have this code, which you can then type in, and it will allow you to create a list, add a list, access your list. So I've now done that with the two-factor authentication. I'll click on create a list, and then I'll start by creating a name. So for example, I can go for my Monday clinic, click save, and it adds my list. So to start, it will be empty, but then you can click on start adding patients. Similarly as before, you can type in the NHS number, date of birth, click find a patient, or use a test patient as well. But we've created a simpler version or a simpler way to be able to add more than one patient in one time. So if you know what patients are coming next, or if you've got at least 2 patients or even 1 as well, it's quicker than having to type it every time. So what you'll do is click on upload CSV file. You can then select your CSV file created, which will be very simple. All it will have is the NHS number and the date of birth of the patient. So each row will be a single patient. Click on open. It will then do the search for you. So instead of having to do this every single time, it will automatically do it for you. And it will then show if there's any kind of errors. So for example, if it's an invalid NHS number, it will let you know. Or if there's a duplicate, so that you don't have a really long list, or you've only got the patients you effectively have to look after, it will let you know. Once you've seen this and you're okay and you've seen it, you can click okay, got it. You can hide this as well, and you've got your list of patients over here. What you can then do is, if for example, if you've got a longer list, or if it's some way to make it easier, you can sort the list. You can either do it by last added or first added, so depending on when you've added the patient to the list itself, or you can order it alphabetically, which would then just make it a bit easier. Oh no, sorry. Can then click on it to order it alphabetically, and then it changes it. So it just makes it a bit easier to search for the patient that you need. Once you want to start contacting a patient, let's say I've got a video call with Julie, I'll click on contact. I can then invite to a video consult, can also message a patient, or go back to the seal contact options, which was the view we had before, where you could click send a video or SMS. I'll click on send a video consult. It will automatically pull the number of the patient on PDS. I could also email them if I had their email address. This is a bit easier, for example, if the patient wants to join the call from a computer or another device that's not their phone. And then something we've released quite recently is that you can have a video template as well. So you can have one that you've already created and click on it and it adds it, or you can create a new template. For example, video invite. Join the call today we can then add the time later. And what you can do is create this as a default template. So then when you go next and send a video invite to any patient, you can then have this automatically pulled up, and you don't have to then go back and select it. So it's set as a default template, and you can see that it automatically added it for this message as well, and it will appear each time. I can always go change it and choose something else. So call for today at 1 p.m. I can then click send, and that message is sent through to Julie, which then can join the call. What you can see is, compared to the other patients on the list, for Julie, there's a bit of an extra information. So to start, you can join the call just directly by clicking on join call. Via the normal search of the patient, you would have to either make sure that the window is there and you've got the link, or if you go back and check on the email that you received where the verification has been sent. And you can also see what's going on the other side. So where is the patient in to join the call? At the moment, it says video consult invitation received. So that means that Julie has that invitation and they have the link. A couple of things that you can do. So if, for example, with this call with Julie, you want to invite a colleague or a translator or someone else to join the call within your organization, what you can do is click on more, click on share list. And what it will allow you to do is to share this list of patients, so the whole Monday clinic, with another colleague in your organization. So you can type in an email here, and once you type in the email, you click share, and then the other person will receive it on their accuRx web. So then when they log in, they'll be able to access it. If they haven't set up patient lists, they'll be guided to set that up as well, but everything will be quickly available to them. Other couple of options that you can do over here as well is you can also send a message directly. So there's a couple of features when you're sending a simple message to a patient. So click on message patient, and then here, in this case, there's no mobile number on PDS because it's a test patient, but in case there was, it would automatically show it as well. Similarly, for the video, you can create a new template, add it over here, or you can select a template from the drop down, any that you've created previously. So I think we've got a couple over here from testing. Couple of other things you can do. So you can either send the message as it is with your template, maybe reminding the patients to do something, or you can also attach a file. So you can click on attach file, you can attach a photo, a PDF, click on open, and what it does is that it creates a link at the bottom of the message that the patient can access for up to 28 days. What they'll do is they'll click on the link, enter the date of birth to make sure it's them, and then they'll be able to access this document or image that has been sent. They can then open that on a computer or print it, or whichever is most useful for them. Another option as well is, in general with accuRx messages, patients can't reply to the messages, but you can ask for the patients to reply. So you click on this tick box, and then it will add a link at the bottom, maybe make it simpler by removing the attach, and you can see the link is over there. So the patient will receive the message, they'll be able to reply by either typing something or sending photos back. You as the user will receive it back into your NHS email, and then from there, you will be able to access the response via a secure link. What you can see is a couple of changes of, so we send the message, that's been done. We can see that it's changed on Julie. So before it said recipient setting up device, or right now you can see that Julie has effectively joined the call. So it confirms that on the other hand, in this case, my colleague has joined the call, set up the video, and they're ready. So you can click on join call, and that way you can join it directly with the colleague on the other side, with the patient, sorry, in this case, for me, it's a colleague. And so, yeah, so here you've got the list. You can add as many patients as you want. You can create as many lists as you want, if you've got like a general cohort of patients or specific clinics. And yes, you can also clear them out if it's a bit easier. So you can go on sort of delete list in case you end up having a lot, or you can remove a patient at a time or multiple patients in one go. Thank you. So next, I think I'm handing over to Matt.
Thanks, Eleanor, for that. I'll just share my screen again. So hopefully I'm showing the same one. Fab, hopefully you can see a slide that says next up on our roadmap again now. Fantastic. Cool. So yeah, thank you for that demo, Eleanor. What I wanted to talk through now was just briefly a couple of things on our roadmap, and actually we've talked about them a couple of them before, but wanted to share some context on why we've not, I suppose, tackled them quite as quick as we'd hoped before we go on to a couple of the bigger features coming down the line. So one of the things that you probably would have noticed, apologies about the quality if these are a bit blurry. One of the things that you would have noticed from the ability for us to send appointments, either from the demo or from what you've already seen yourselves, is at the moment, we are largely kind of optimized for ad hoc video consultations, or you can send a video consultation up to 24 hours in advance. We know from our user research and talking to clinicians and talking to you that actually your diaries are a lot more structured than that, and you quite happily like to book things further into the future. So what you can see here is just some designs of how in the future we are going to support scheduled appointments. So what this will allow you to do is to book an appointment in advance with a time and date with a patient, and it will send them an SMS to say this is your appointment and this is booked, and you will receive another SMS with your link prior to that video consultation. So we are actually sort of halfway through this work. The reason it was paused is because we have been working on vaccine booking and tracking, which has taken over sort of as our key priority. But we will be picking this work back up. We know that it's an important thing in the secondary care settings to have more structure around that. So scheduling a video consultation is something that we will be doing. Once you've obviously got a scheduled one, what this is showing you here is joining a video consult. Again, you can obviously join from the call here, and you can have different dates for your lists. So you'll be able to navigate through when those days are to go and see when the patients are there. So this is really a combination of what Eleanor showed you in terms of like that waiting functionality. So you know when someone's on the call, and the ability to have a scheduled appointment. And what we've also demoed there as well is the sharing of the patient lists. At the moment, it's not quite as clear and visible as who you've given that list to. And what this feature is, or what this demo is just showing you here, is that we'll make that clearer so that you can see who else is looking at that list with you, who else has got access to it, and how you're working through the list. So I just wanted to, I suppose, just share that context again for those who'd seen this and perhaps was wondering where it was and why it had been delayed, and that's the case. One thing that we did share at a previous session, but that we're not looking into any further at the moment, is the ability to make a phone call from accuRx Web. So we were looking into the ability to use VoIP or voice over IP. So you'd be able to make a call from web. So say you were going through your video consultations and someone didn't join or was having a problem, you could quickly jump to phone. We've paused that for the time being. Our rationale around that is that we haven't seen a huge demand. People have said it would be a nice to have. We don't think it will fundamentally change, the ability to quickly pick up a phone in the office and dial a number rather than having to log in, search for an NHS number and a date of birth and then making that call. But it is something that's in the backlog and we may come back to, but it's not in our short-term roadmap. So just wanted to be sort of open with that right now. Two of the big things that we kind of alluded to both in the vision and that we've been talking about that are coming down the line and we've now sort of have teams lined up and working on are both our record access product and also accumail. So Satya is going to give you a demo of these two features now. So I shall stop sharing and pass over to Satya.
Brilliant, thanks Matt. I'm just going to share my screen. Are you able to see my screen? Somebody just says yes, because I've now lost you all off mine.
Yes.
That was in unison, so that was great. Hi everyone, so my name's Satya. I'm one of the clinical leads at accuRx. Like Matt said, I'm going to be showing you two features that are currently in development, and we're looking for kind of pilot sites and anyone who's interested in trialing these features. So the first one is record access. Record access allows you to view a summary of the patient's GP medical record with the patient's explicit permission for up to 24 hours in accuRx Web. And the reason why we can do that is, as Matt kind of stated earlier, we are used by 99% of GP practices, and because of our integrations with the GP clinical system, we can now return a view of the patient's GP medical record, and it will have a little bit more information than you would typically get from things like summary care records, etc. So to use the record access feature, the first step is to search for a patient, like with anything in accuRx Web. So you would use their NHS number and date of birth to return the patient whose record you want to access. In this case, we're going to use my favourite test patient, Julie Adams. So you search for the patient. Confirm that you've got the right patient, so you can see that the demographic details are returned here, and then to request the record you would click on this record access icon. This won't be visible to everyone in accuRx Web at the moment. Like I said, we're working on these features and testing with a handful of sites at the moment. So if you click on record access, the way that the feature works, or the way that the patient gives their explicit permission, is they receive a text message with information saying, Satya Ragvanshi at the accuRx practice would like to view your medical records. If you're happy to share or to give access, please share the 6-digit code back with the clinician. So the way that this works is essentially two-factor authentication. So you can see here the patient's mobile number has been returned. Unlike in other areas of web, we don't let you enter another number here or an alternative number for the patient, because we don't want people to be able to bypass the patient permission step. So this will send a message across to Julie Adams, which in this case is linked to my phone number. Like I said, Julie will receive a text that says, Let me just see. Satya Raghavanshi from the accuRx practice would like access to your medical records. To provide access, give them the code, and there's a 6-digit code that will come through in the text message. And then in the message that goes across to the patient, there's also some information about what to do if the request is unexpected, and they can see kind of what content will be shared. If they won't be able to view their own medical records, and this is not a way for patients to bypass approaching the GP practice. They cannot use this to view their own records. This is only to give the clinician permission to view their record. So I'm just waiting for that text to come through. Very helpfully, I've now lost network provider, which is always the way. And once the text comes through, I would enter the 6-digit code, and then that would allow me to view Julie's record. So the way that, like I said, the way that this essentially works is the SMS goes to the patient. The expectation here is that you will already be speaking to the patient, or have let the patient know that you'll be accessing their records. That might be via, a video consultation. It might be because the patient's face-to-face in A&E. It might be that you've had a telephone call with them for an outpatient appointment. And so there's an expectation here that you've already spoken to the patient, or the patient will already know who you are before they share the record. There we go. Whilst we wait for that text to come through, I can actually show you what the record will look like. So I'm just going to, in a true Blue Peter moment, go across to a record that I pulled earlier. So continue. And this is the view of the medical record that would be returned. So you can see here, you've got the patient's demographic details up here. You've got their NHS number, their contact details, and their kind of mobile number. And if we work through the right-hand panel first, you'll see that their GP practicer details are returned, and they're not returned in this case just because it's a test patient in our test environment. You'll also have the health status returned, so that's BMI, smoking, alcohol status, where that's been noted in the GP record. Investigations going back the last 2 years, including kind of blood tests with reference ranges, if they've had any blood pressure readings, etc. Here you can see kind of a SATS monitoring. And then working down, you'll also get their immunisation status, so you can see which immunisations they've had and when. So you can see this patient's had their influenza vaccination in 2006. And then working through the main panel, there's a little banner just at the top to say that there are certain sensitive data sets and codes that we don't return. Those are codes specifically relating to IVF, STIs, assisted conception, and gender reassignment. The rationale for this is these are codes that are maintained by the RCGP and Joint GP IT Committee, who have said these codes should not be routinely returned when records are being shared across organisations. So at the moment we don't include those. We will be looking at whether this is something we want to do going forwards, but currently we won't be returning those codes at the moment. And then working our way down, we've got the active problem list broken down by significant and minor, past problems again broken down by significant and minor problems. And then working further down, we've got health admin problems, which are typically things like whether the patient's, a cervical screen non-attender, a breast screening non-attender, potentially when they've had their last diabetic retinopathy screen. So that sort of information tends to be captured in the GP record under health admin problems. And then working further down, you've got this bright orange banner here to capture allergies and sensitivities. You'll get the type of allergy, as well as any comments relating to the nature of that allergy as well. So if somebody's specifically written, this patient gets angioedema with a penicillin allergy, that will be pulled across from the record. And then further down, you've got current medications as well. So medications are broken down by current and past medications going back over the last 6 months. So you've got acute and repeat prescriptions. And here you can see you've got all the relevant information in terms of the date the prescription was first written, the last issue date, the number of issues, and obviously all the dosing instructions as well. With past medications, like I said, it goes back to the last 6 months, again broken down by acute and repeat medications that they've had in the previous 6 months. And then also the last 3 GP consultations. We're still working with GPs to decide whether or not this will be available to secondary care providers. There is some concern of exposing third-party information. So this may or may not be available. It's likely if you are already linked to, if you're a GP viewing your own records via accuRx Web, you will be able to see this, but this may not be visible for other secondary care providers. We're still working with GPs, and some GPs are very strongly in favour of showing this, some GPs aren't. So like I said, this is still in development, and while we kind of figure out those teething bits. And then there's a full audit trail both on the GP side when a patient's consented to their record being shared, as well as on the secondary care side. So in terms of the audit trail, if you click on medical records here, like I said, you'll be able to see which records you've requested. The records are only visible for 24 hours. After 24 hours, they disappear, and you would then need to request a new record. And you can see here, this is a attempt that I just made where it said patient authorization required, and the text has just come through, which is always the nature of live demos. And you can read about the statuses so that you understand exactly kind of where you are in that process, or, you know, if something's failed, why it's failed. There's a little bit of description there. So that's record access. As Matt mentioned, traditional record sharing usually relies on, you know, data sharing agreements existing between organisations. The reason why we can do this is because GPs are still remaining the data controller of their record. However, patients are giving explicit permission for their record to be viewed by somebody who's providing direct care for them. And when we've approached kind of the National Data Guardian and NHSX, you know, they're confident in our approach meets kind of IG and security standards in terms of record sharing. So that's record access. What I'm now going to show you is accumail. Accumail is one of our other features, and what accumail does is it allows you to send a message directly into the patient's GP practice. So again, you would search for a patient. You can see you've got the same patient, my favourite test patient, Julie, returned here. And you can see this accumail icon. So like I said, because we integrate with the personal demographic service, we can return which practice the patient is currently registered to, which you can see here. And as long as it's an accuRx using practice, which, you know, 99% of GP practices in England are, you can then send a message directly into the patient's GP practice. And this will be received in their kind of accuRx toolbar, which GPs are very, very familiar with using. So you can choose from templates or write your own message, freehand your own message. So you can see here, this is just about a notification of admission. And if you want to send documents as well, you can attach files. So if you wanted to send something like a copy of a past clinic letter or some other information about the patient, you could send that across to the GP practice. Equally, this could be used in care homes to contact the GP practice. We know we have lots of web users across secondary care and acute mental health trusts, in the community, as well as kind of care home services, ambulance services, etc. So if you are using accuRx Web, you could use this to message into the patient's GP practice from any one of those settings. Once you've written your message and you're happy with the content of your message, you would hit send. There is a copy of the message here, so if you do want to save this message back into your EPR, you can do that just by hitting copy and then pasting it directly into your clinical record system. I'm just going to show you what it looks like on the GP end when a message is received. So if I open up EMIS, EMIS Web is one of the clinical systems that GPs use, used by about 45% of GP systems, 45% of GP practices, and it's one of the systems that accuRx integrates with. And if I open up the accuRx toolbar, you can see here, this is the toolbar that sits on top of the GP clinical system. And you can see there's an icon here and with a notification, and that means there's a new message that's come through. The message by default is visible to anyone in the practice, and that's a safety mechanism just to make sure that, you know, emails don't get missed, or if somebody's away, for example, or there's a locum, etc. So when they click on the inbox icon, they can see this is the message that I've just sent. They can open up the letter, and on the GP side, they can also save any incoming attachments directly back to their clinical system. If they reply to this, you will receive an email back into your NHS mail as normal. So if the GP chooses to reply to a conversation you've initiated from accuRx Web, it will revert to a normal email thread in your personal NHS mail. So they can reply saying thanks for sending this across, for example, and then save that back to the record. And on the GP side, again, everything that we do and because of that integration, saves back to the record automatically. So once that's sent, a GP can look at the consultations to see kind of, this is the incoming message. Oh, that one's actually from earlier. And when a message has been received, I think this one's still sending. This is still sending. So once that's sent, that will save back into the GP record. And there's again an audit trail of all communication that you've had, both from web and from desktop. So those are kind of our new features, which are record access, allowing you to view a summary of the patient's record for up to 24 hours, and accumail, which allows you to send a message directly into the patient's GP practice. And I'll stop sharing there for any questions.
Thanks, Satya. I think it's just me and you. I think Anna might have had some problems with Wi-Fi. So let me just share the screen as we go through the questions as well. So thanks, everyone. Hopefully that was useful to see some of the features that we've both got planned and some of the things that we've lined up. As Satya mentioned, we're at the start of the journey for record access. We recently did a webinar for all of our primary care providers, basically, who are key to that, and there was a lot of appetite for the feature. And we're rolling out to some pilot areas very soon. accumail is being used in some settings already. Again, it's something that we're looking to roll out and scale. So we'll try and go through some of the questions now. Again, please, it's great. We've tried to answer some as we go, probably some of the sort of quicker ones. Thank you for those who are upvoting on others, but as we go through. So one of the questions is, I would like to know whether you are exploring any features which exist in other platforms like chat, drawing on the video consults. So yes, I think we have. So the provider that we use for video is a company called Whereby. They offer integrations with Miro. They also offer a chat functionality. The challenge for us at the moment is we don't have the ability to set some of those features per organization. So when we first rolled out the product, there was actually, we had concerns that these options were available in the product. For example, that someone might miss a chat or someone might draw something on the board. Satya, you probably know better around the clinical rationale here, but essentially at the moment, they are turned off for everyone by default. I expect in the future that we'll come to review that so that different settings and different organizations can choose what they want at an organization level. So if you're at, I don't know, Trust A, and Trust A would very much like chat, then we can support chat. But at the moment, it's kind of a blanket on-off across the whole product, I'm afraid. I don't know if you had anything you wanted to add there on that one at all, Satya.
No, I think you've hit the nail on the head, which is we did have that chat function. We did turn it off after concerns from some trust, and like you said, we'll probably revisit that in the future, because it's very likely that we'd want the ability that if you want the chat function for us to turn it on for you. Yeah,
no, that's perfect. Thank you. Satya, possibly for you, the next one. So the record access is interesting. Remember the wording, though, in many instances, pediatric practice, you'll be asking someone for someone else's record. So the wording would need to be about third-party permission to access on behalf of someone else, etc.
Absolutely. I think we can set kind of different messages. So it's definitely something that we'd want to do. This is the first iteration. So the copy and everything will be improved kind of as we iterate on the product. But very mindful of the fact that it may be somebody giving proxy consent on behalf of someone who's underage. So we all kind of figure out the wording accordingly on that.
Cool, thank you. Then there's a question here about how can we share pictures on accuRx used on iPad. So I think there's probably a couple of answers here. So if you want a patient, you can send an SMS to a patient with the link. If they want to get that onto the iPad, then they'll need to copy that link perhaps from their mobile phone to the iPad, and then they can take a picture on the iPad and send. So that's how a patient could do that. If this is more of like a healthcare professional setting, so you can use accuRx on an iPad, for example. So you could take a message with the iPad and then attach it either as an accumail to send it to someone else in that scenario, if that is what you meant in terms of sharing those uses. Those are the main sort of use cases that I can think of where you would attach it either as an accumail or as a patient. But at the moment, the only thing we allow to send via email are video consultation invites. Everything else is sent via SMS. There's a question here around, will users be able to blur out backgrounds for video calls? So again, because we use a video provider, as part of the experience, whereby we don't control the features that they roll out and offer. Now, I do know that they are working on this at the moment. One of the challenges is just how much like computer processing and memory this takes up when it's happening. So one of the reasons we use and like Whereby is obviously it doesn't require an app. It works on nearly all modern browsers. There's sort of very, very low barriers to adoption. Blurring tends to work best when you've got a thing installed or downloaded, like Teams or Zoom. They are looking into it. They haven't given us a confirmed answer of whether or not they'll roll it out because they want to make sure that it doesn't damage performance basically before they do that. So but yeah, that's where we are in terms of blurring. Satya, I don't know if you want to take this on. I'm not sure if there are any plans about will a recording feature be added in the future? Recording clinical activity is essential for our trainees and their course completion. I'm guessing that might be about video.
Yes, yeah. So I think at the moment, the reason why we haven't done that is just because of the file sizes when things are being recorded and how that's stored and kind of the governance around that. So it's not something that's currently on the roadmap. I would say, and part of the rationale is because at the moment, your activity in accuRx Web comes back to your NHS mail. If we start sending recordings of video consultation appointments, etc., you will hit your NHS mail inbox limits very, very quickly. So it's definitely something we've talked about, and that's kind of the rationale why we haven't built it. Again, it's something that we may well revisit, but currently there's no plans to kind of offer that recording feature.
Oh, I don't know if I just accidentally, no, that one's done. We have group sessions which the therapist may run. Is there an option to invite more than one service user to the consultation? Are you happy to take that one, Satya, as well?
Yeah, absolutely. So there's a few ways that you could do that. So like Eleanor showed, if it's a clinician or another healthcare professional that you're inviting, and they're within your organisation, you can share your patient list. That would allow them to see the list of patients and also see when the patient has actually joined the video consultation. Equally, if you wanted to jump on a call about a patient before the patient joins, you could do that as well from the patient list function. Currently, just generally, in terms of the room sizes, you can invite up to 4 people total in the rooms. So that's you and potentially 3 other people, and one of them presumably being the patient. To do that, when you open up the tab, there is an option to share the invite. As long as you have their email address, you can share that with interpreters or anybody else who you want on the call. We do also have the functionality to increase those room sizes to up to 50 people, so that would be up to 12 people on video, and then potentially 38, up to another 38 on audio. It's something that previously we've talked about whether we kind of put it with the high price model. I think essentially we're happy if you would like it to turn it on, we can turn that on for you. Just get in touch with us if you'd want access to the larger room sizes.
Okay. We've sorry, I just sorry, 1 second. We have a couple of webinars today, and it looks like there's a couple of challenges with running concurrent webinars. So we'll probably just whip through these questions and try and wrap up about 15 minutes early. Apologies for that. But let's have a quick look as we go through. Obviously, we'll share with the recording afterwards and the questions, and there'll be contacts for us if anyone wants to get through to us as well. So I'll try and whip through these quickly. Can you only share the list and invite people who have an accuRx account? That is the instance at the moment. You can only share with other accuRx users. We'll look to extend that in the future, but they can create a free account providing they have an nhs.net or an NHS UK address. So feel free to get them to sign up for that. Sorry,
yeah,
Satya.
I was just going to say, I think at the moment, in terms of sharing the list, that would definitely be with accuRx Web users, and the majority of medical students probably won't have NHS.net accounts. However, you can invite them to the video consultations as long as you have any email address or any contact details for them, like I said, from the video consultation itself. So there is an option to say invite additional users, and you can do that to invite them in. But to share the list, they would need to be an accuRx Web user within your organisation.
Perfect. Is there a prospect of linking to curated directory or formulary of patient information videos, such as that hosted by HCI. So in templates, you can add links to things. So if you want to create templates with a link to your own directories, your own videos, you're more than welcome to do that. And that's the best way to use templates, I would actually say, is if you can link to other hosted content or other forms that you want people to download and access. Just make sure, obviously, they're not personal, because anyone can then access that link. But yeah, you can definitely send out links to that. We will be... as I said, we'll be sharing this link afterwards in a follow-up email. It'll also be available on the YouTube channel. Couple of questions. Will we use accuRx alongside System 1? Why would we need access to the record? Definitely not in that situation. Like, if you already have access to the record, that's absolutely fine. And I think, record access might be useful in remote situations for you if you were perhaps out on a visit. But largely, where we see a core amount of the value is coming from people who don't have access to that record, and you want to share that across a community setting or with different other organizations to enable that. Cool. And the last couple of questions. Can you send you can't send a group text message from the patient list at the moment to invite them all in one go. It is something we've been thinking about in the roadmap, but it's not going to be in the first release for us, but it's definitely something we have considered. Will there be subtitles moving forwards? It's a good question. I'm not sure about whereby on that. We'd have to check that one. We'd have to check that one out, because I'm not sure if that is on their roadmap. Again, with that, we'd be reliant on our video supplier to offer that. And then last couple of questions. There isn't a priority tab when sending an accumail at the moment. We have had good feedback that accumail gets checked more regularly, because actually GP practices use the toolbar like nearly all the time, because it's a core part of their workflow. It's something we'd investigate if there was a feeling that things could get missed or that it wasn't a key part of the flow as we go through. How can you send an SMS? So you could send an SMS to a young person and an email to a school. I'm not quite sure on that question. So you could send an SMS to a patient, and then if you wanted to contact, or if you wanted to invite someone else to that video consultation, you would need to share the video link in an email outside of that. And then I'll take this as the last one. Again, apologies, we've had to cut the Q&A slightly short. It's just, yeah, we need to run another webinar at the same time, it would seem. If sending a link, especially to more than one relative, I don't always want my NHS email address spread. Are there plans to allow links to be sent? So everything that is sent out from accuRx Web has no personal information of yours attached to it. So if you send a video consultation invite via email, it will not share your email address. It's the same if you send a patient response. Although the reply will come back to you, we will not expose your email address. We do not expose your number or your email address to any patients in any of the communication that happens. The only point where your email address would become visible was if you sent an accumail to a GP practice. They would see in the reply bar where that was going back to. So a patient wouldn't see that at all.
Yeah, just to reiterate, any messages that are sent via the accuRx nhs.net account. So all patient identifiable data is sent securely, even things like video consultation invites. But just to reiterate, as Matt said, it won't be linked to your personal NHS mail address. The patient won't have access to your mobile number, your personal NHS mail, or any details about you.
Fab. Thank you everyone for joining. As I said, apologies, we've had to slightly cut short, but please feel free to jump on support if there's any further questions, and we will follow up with an email. Thanks everyone.
Brilliant, thank you.